Okay, so I'm Tim Hubbard. I'm head of the genetics department at King's. My history as a researcher is I was involved in sequencing the human genome 20 years ago. Now, it cost a vast amount of money then, a single genome. Now it's become a millionfold cheaper, and that's why we're now trying to use that in the health service, because I'm also part of Genomics England. Now, the whole idea of using that for research to improve your healthcare is to personalize your healthcare. You're all different, your genomes are all slightly different, and if we can understand that, we can personalize your care. So you don't get drugs that aren't going to work for you, you get the right drug dose, you get the right treatment. Problem is we don't understand the genome very well. We can only do very limited things right now. And so one take-home message is, in order to improve that, we need a lot of data. And that's why access to data is really important to improve this research. So if you look at these things here that I've listed, that's our objective. The benefits of this is improving your healthcare. It's a global enterprise. Humans are all the same really worldwide. There's subtle differences, but in general, if we compare humans across the planet, that data, it will benefit everybody globally. And of course, as researchers, if we can't get access to the data, we end up not being able to do follow-on research. We'd end up not being able to raise money for grants. We end up having to do something else instead. So what are the concerns? Well, trust is a real issue in terms of how we manage to do this research. The first genome was freely available to everybody. You can download it yourself. But as we start working with people who've had their genomes sequenced for healthcare, trust and holding that data securely becomes a very important issue for researchers. And so Genomics England has constructed a trusted research environment where the data is not distributed. You have to do analysis inside that environment. You can't take any data out. But that puts barriers in place for carrying out research. It makes it slightly harder to do that research. So as a researcher, we're concerned, can we actually do the research analysis that we need to make these improvements? Is the balance correct for you, for optimizing the output? So this is what we want feedback on, about what's the right level of trade-off between efficient research and good security, this balancing. And then there's this business of publications. Feedback to you in many ways. One of the changes that's happened over the last 20 years or so, all publications used to be in journals that you had to go to a library, an academic library, to read. So you couldn't see what research outputs were coming, what people were really publishing. A lot of that is now freely available, but that costs money as well. And so it's a kind of issue for researchers. Can we pay the charges to make sure our research gets published so everybody can read it?